Well, if you've noticed more people around you getting sick, it's because the number of COVID cases is going up. In fact, the CDC reports dozens of states seeing an uptick in cases, including Minnesota. Jennifer Hoff has more on what's behind it and when you may be able to get your next vaccine.
The summer of sizzle is also now the summer of sick, as the Centers for Disease Control reports COVID-19 infections are growing or likely growing in 45 states, including Minnesota.
We always are concerned, and there is an uptick, yes.
Longtime doctor Miriam Roby says COVID typically declines in the summer, but not this year as people gather inside to beat the heat.
We've come such a long way, but yet we still have so far to go.
3 new variants are driving the surge, accounting for 60% of cases. But doctors say while the symptoms aren't as severe, they are similar to a cold, and that can lead to further spread if people don't take precautions. And data shows only 1 in 5 adults are now vaccinated.
We're now post-COVID, and we will never return to our life that was prior to that. So now we acclimate to life post-COVID, and how do we just adapt and try to make sure that we stay in this new era as healthy as we can.
Dr. Roby's job is also to ensure healthcare equity and continues to provide outreach to communities of color that research shows have higher chances of needing care.
I think they want to talk about it, and they're wanting a space and a lane to just be heard.
Riding out the next wave and staying as safe as possible.
There is hope. There's hope.
There's also this, though. Doctors say these new variants are better at evading vaccines or previous infections. So the CDC is recommending that anyone over 65 or who is immunocompromised should get the current shot, but everybody else can just wait until the fall. If you get sick and have symptoms, the CDC is also asking that you isolate. Otherwise, if you don't have symptoms but are still positive, you don't necessarily have to do that. Julie?